What does insulin do? Allows for the passage of glucose into the cells. What causes diabetes mellitus? When B cells of the pancreas reduce the amount of insulin secreted. What are some possibilities for the cause of diabetes mellitus type 1? By viral infection that attacks the pancreatic B cells or caused by the immune system targeting the pancreatic B cells. What causes diabetes mellitus type 2? Pancreas is less responsive to stimulation from increased blood glucose levels. What happens during diabetic ketoacidosis? Decrease insulin levels, increase blood glucose levels, cells become glucose depleted, metabolic acidosis ensues. What happens during hypoglycemia? Insulin shock, rapid onset, increase insulin levels, decrease blood glucose levels, lack of glucose causes brain injury. What are the trade names for insulin? Humulin, Novolin, Illidan. What is the class for insulin? Hormone and anti-hyperglycemic. What is the mechanism of action for insulin? Combines with insulin receptors present, promotes glucose entry into the cell, lowers the blood glucose level. What are the pharmacokinetics of insulin? Onset, 30 to 60 minutes. Peak effects, 2 to 3 hours. Duration, 5 to 7 minutes. Half-life, 13 hours. What are the indications for insulin? Diabetic ketoacidosis, hyperglycemia, hyperkalemia. What are some contraindications for insulin? Only administered when hyperglycemia or ketoacidosis has been confirmed. What are some side effects of insulin? Hypoglycemia, itching, swelling, redness, allergic. What is the class of glucagon? Hormone and anti-hypoglycemic. What is the mechanism of action for glucagon? Breakdown of glycogen to glucose, inhibits synthesis of glycogen from glucose. Both tend to increase circulating blood glucose. What are the pharmacokinetics for glucagon? Onset, 5 to 20 minutes. Peak effects, 30 minutes. Duration, 1 to 2 hours. Half-life, N/A. What are the indications for glucagon? Hypoglycemia, B blocker overdose. What is the contraindication for glucagon? Hypersensitivity. What are the side effects for glucagon? Hypotension, dizziness, headache, nausea and vomiting. What is the trade name for 50% dextrose in water? D50W. What is the class for 50% dextrose in water? Carbohydrate. What is the mechanism of action for 50% dextrose in water? Dextrose supplies supplemental glucose in cases of hypoglycemia. Serious brain injury is hypoglycemia is prolonged. What are the pharmacokinetics for 50% dextrose in water? Onset, less than 1 minute. Peak effects, variable duration, variable half-life, N/A. What are the indications for 50% dextrose in water? Hypoglycemia, coma or unknown origin. What are some contraindications for 50% dextrose in water? No major contraindications to IV administration. Use with caution in patients with ICP, may worsen cerebral edema. What are some side effects of 50% dextrose in water? Tissue necrosis and phlebitis at the injection site. Examples of unintentional toxicologic emergencies? Medication dosing errors, childhood poisonings, workplace hazards, simple neglect or oversight. Examples of intentional poisoning? Bioterrorism, date rape drugs, chloral hydrate, pharmacologic agents used in homicide. What are some general signs and symptoms of a stimulant? Restlessness, agitation, dilated pupils, insomnia, tachycardia, tachypnea, hypertension/hypotension, seizures. What are some general signs and symptoms of a narcotic? Constricted pupils, respiratory depression, drowsiness, stupor, coma, needle marks. What are some general signs and symptoms of a sympathomimetic? Hypertension, tachycardia, dilated pupils, agitation, seizures, hyperthermia. What are some general signs and symptoms of a sedative/hypnotic? Drowsiness, disinhibition, ataxia, slurred speech, mental confusion, respiratory depression, CNS depression, hypotension. What are some general signs and symptoms of a cholinergic? Increased salivation, lacrimation, gastrointestinal distress, diarrhea, respiratory depression, apnea, seizures, coma. What are some general signs and symptoms of an anticholinergic? Dry, flushed skin, hyperthermia, dilated pupils, blurred vision, tachycardia, mild hallucinations, dramatic delirium. Define substance abuse. Self-administration of licit or illicit substances in a manner not in accord with approved medical or social practice. What are the toxic effects of alcohol abuse? Prone to illness and injuries, damage to the CNS leads to deterioration in higher mental functions, damage to cerebellum results in balance problems, damage to peripheral nerves leads to decreased sensation. What are the effects of alcohol abuse on the digestive system? Irritates tissue, damages stomach lining, gastritis. What are the effects of alcohol abuse on the liver? Variety of complications, coagulopathies, hypoglycemia, gastrointestinal bleeding, high risk of acute pancreatitis. What is the role of regional poison centers? To provide information and advice to caregivers encountering poison patients, available 24/7. What is the definition of toxidromes? A set of clinical signs that are considered diagnostic of certain toxins or classes of toxins. What is the route of exposure for acetaminophen in toxicologic emergencies? Oral. What is considered a toxic dose for acute ingestion of acetaminophen? Greater than 7.5 grams or 140 milligrams per kilogram. What are the routes of administration for anticholinergics in toxicologic emergencies? Oral, intravenous, dermal. What is the mechanism of toxicity of anticholinergics? Cholinergic blockade occurs both centrally and peripherally, involves mucarinic and nicotinic, toxic dose varies depending on agent. What are some peripheral signs and symptoms of anticholinergics in toxicologic emergencies? Dry skin/mucous membranes, thirst, dysphagia, blurred vision, fixed dilated pupils, tachycardia, fine red rash, hyperthermia, abdominal distension, urinary urgency or retention. What are some central signs and symptoms of anticholinergics in toxicologic emergencies? Lethargy, confusion, restlessness, delirium, hallucinations, ataxia, seizures. What are the routes of administration for neuroleptics in toxicologic emergencies? Oral, intravenous, intramuscular. What is the mechanism of toxicity for neuroleptics? Act by blocking neurotransmission involving dopaminergic, adrenergic, muscarinic, and histaminic receptors. What are some signs and symptoms of neuroleptics in toxicologic emergencies? Dystonic reaction, akathisia, Parkinsonism, tardive dyskinesia. What are the symptoms of neuroleptic malignant syndrome? Life-threatening condition, 10% mortality, hyperthermia, rigidity, altered mental status, autonomic instability. What are the generic names for flumazenil? Anaxate, Ramazacon. What is the class of flumazenil? Benzodiazepine antagonist. What is the mechanism of action for flumazenil? antagonizes the actions of benzodiazepines in the CNS, used to reverse the sedative effects of benzodiazepines. What are the side effects of flumazenil? Fatigue, headache, agitation, nervousness, dizziness, flushing, confusion, convulsions, dysrhythmias, nausea and vomiting. What are the routes of exposure for beta blockers in toxicologic emergencies? Generally oral, occasionally ocular. What is the mechanism of toxicity for beta blockers? Cause blockade of both B1 and B2 receptors in the adrenergic nervous system, affect both cardiovascular and respiratory systems. What are the signs and symptoms of beta blockers in a toxicologic emergency? Bradycardia, AV blockade, hypotension, tachycardia, LOC changes, bronchospasm, congestive heart failure. What are the routes of exposure for calcium channel blockers in toxicologic emergencies? Oral, sublingual, intravenous. What is the mechanism of action for calcium channel blockers in a toxicologic emergencies? Blockade at calcium receptors, affects, and cell utilizing calcium. Myocardium, sinoatrial node, AV nodal conduction pathway, muscle fibers etc. What are some signs and symptoms of calcium channel blockers in toxicologic emergencies? Hypotension, bradycardia, AV conduction blocks, lethargy and slurred speech, nausea/vomiting, coma, respiratory depression. What is the pre-hospital management of calcium channel blockers in a toxicologic emergency? Supportive care, activate charcoal, atropine or isoproterenol, IV fluids, inotropes. What are the routes of administration for carbon monoxide in a toxicologic emergency? Inhalation. What is the mechanism of toxicity for carbon monoxide in a toxicologic emergency? Binds to hemoglobin, reduces availability of hemoglobin to carry oxygen, induces hypoxemia. What are the signs and symptoms of carbon monoxide in a toxicologic emergency? Generally asymptomatic. What are the signs and symptoms of carbon monoxide in a toxicologic emergency? Headache and dyspnea. What are the signs and symptoms of carbon monoxide in a toxicologic emergency? Headache, fatigue, and visual disturbance. What are the signs and symptoms of carbon monoxide in a toxicologic emergency? Tachycardia and altered LOC may precipitate angina. What are the signs and symptoms of carbon monoxide in a toxicologic emergency? Coma, seizures, and cherry red skin. What is the pre-hospital management for carbon monoxide in a toxicologic emergency? Supportive care, airway management, supplemental O2 SpO2 is unreliable. What are the routes of exposure for cyanide? Inhalation, ingestion, intravenous, dermal contact. What is the mechanism of toxicity of cyanide? Binds a key cellular enzyme, cytochrome oxidase, causes cellular asphyxia, affecting all organ systems. What are some signs and symptoms of cyanide? Quickly post-exposure in a toxicologic emergency. Unconscious, non-cyanotic, hypotensive, bradycardia, death occurs in sex mens. What are the signs and symptoms of cyanide in less severe cases post-exposure in a toxicologic emergency? Headache, dyspnea, confusion, seizures with hypotension. What is the pre-hospital management of cyanide in a toxicologic emergency? Supportive care, Pasadena cyanide antidote kit, if available. What is the class of amyl nitrite? Vasodilator/cyanide antidote. What is the mechanism of action for amyl nitrite? Causes oxidation of hemoglobin to a compound called methemoglobin. Methemoglobin reacts with cyanide ion to form cyanomethemoglobin, which can be enzymatically degraded and eliminated. What are the side effects for amyl nitrite? Headache, weakness, dizziness, flushing, cold sweats, tachycardia, syncope, orthostatic hypotension, nausea and vomiting. What is the class of sodium nitrite? Nitrate/cyanide antidote. What is the mechanism of action for sodium nitrite? Helps convert hemoglobin to methemoglobin. Methemoglobin draws cyanide from cells, must be detoxified by sodium thiosulfate. What is the class of sodium thiosulfate? Cyanide antidote. What is the mechanism of action for sodium thiosulfate? Major route of detoxification of cyanide in the body is conversion to thiocyanate. Thiocyanate is removed by the kidneys. What is a generic name for cyclic antidepressants? Tricyclics. What is the route of exposure for cyclic antidepressants? Oral. What is the mechanism of toxicity for cyclic antidepressants? Blocks norepinephrine, dopamine and serotonin at presynaptic receptor, results in prolonged QT and QRS intervals. What are the general signs and symptoms of cyclic antidepressants in toxicologic emergencies? Dizziness, confusion, blurred vision, dry mouth, tachycardia. What are the pre-hospital managements for cyclic antidepressants in toxicologic emergency? Supportive care, multi-dose of charcoal, sodium bicarbonate. If seizing an SP does not work, use benzodiazepines. What is the route of exposure for digoxin/digitalis? Generally oral. What is the mechanism of toxicity for digoxin/digitalis? Inhibit NOK ATPase, potassium efflux and sodium influx. What are the signs and symptoms of digoxin/digitalis in a toxicologic emergency? Dysrhythmia, fatigue, anorexia, disorientation/confusion, delirium/hallucinations, gastrointestinal upset, visual halos. What is the pre-hospital management for digoxin/digitalis in a toxicologic emergency? Supportive care, fluids for hypotension, multi-dose charcoal, calcium should not be given. What is the route of exposure for ethylene glycol? Generally oral. What is the mechanism of toxicity for ethylene glycol? Toxic metabolites are formed causing acidosis and renal damage. S/S will not appear until 6 to 12 hours after ingestion. What are the phase 1 signs and symptoms for ethylene glycol in a toxicologic emergency? 1 to 12 hours, intoxication, CNS symptoms, ataxia, seizures, nystagmus, nausea/vomiting. What are the phase 2 signs and symptoms for ethylene glycol in a toxicologic emergency? 12 to 36 hours, cardiopulmonary toxicity, hypertension, tachycardia, tachypnea, pulmonary edema, congestive heart failure, shock. What are the phase 3 signs and symptoms for ethylene glycol in a toxicologic emergency? 24 to 72 hours, acute renal toxicity, flank pain,